I guess, Dr. Buchanan, this is the first time we've spoken since everything happened a couple weeks ago at the state level. So Governor Lee says this is not a public health emergency, it's now a managed public health issue. As our top doctor in Knox County, do you agree with that?
Well, I think what's really important to realize, emergency or no emergency, COVID is still very present in our community. We still have new cases, we still have hospitalizations, and we still have people dying from COVID. So COVID's still very real. Regardless of what you call it, it's still very present and very active in our community.
And you all have advised to continue following those 5 core actions. No matter what you call it, don't slack on that, but there's no longer a mask mandate in Knox County. What do you make of that decision?
Well, certainly great question to ask Mayor Jacobs about that decision. The law office has opined that he has the authority to make that decision. And again, I'll go back to COVID's here, COVID's still present, and following the 5 core actions is really what we need people to continue to do. Whether there's a mandate or not, continue to exercise your personal responsibility and follow the 5 core actions, protecting yourself and your loved ones, and when you can get a vaccine.
Well, there's several businesses in Knox County, major businesses and small businesses, that are still opting to keep the mask mandate in place. Some are not. And some people who would have worn a mask before may not feel the need to do so now that the mandate's lifted. Is it going to have a negative impact, or?
Time will tell. We'll have to see. We'll have to see if our cases go up. Right now our cases are, they've actually dropped down just a little bit. Maybe a new plateau, which would be great, a lower plateau. But time will tell whether our cases go back up. Incubation period for COVID-19 is about 2 weeks. So we won't know the effect of this for a couple of weeks.
Okay, and the mayor's office indicated there were several meetings between you and members of his team. I don't know how many, but I was told there were a few conversations prior to this announcement. Are you willing to share what those conversations looked like, whether there was a unanimous agreement at some point?
I was advised of the mayor's intentions, and we had discussions about that. So I wasn't surprised by his decision to remove the mandate.
Anything, I'm still confused about what happened. It feels that Tuesday we were all under the impression that it was your authority, and then it sort of changed in an instant.
It's a great question for the law office and the mayor's office. That decision was made by our law office.
Okay, so, but the change was instant on your end too, I guess. I mean, you were sort of...
The change was based on, you have to ask them, but it was based on the governor's declaration and their interpretation.
Okay, well, how are we doing right now? I know I imagine the numbers are not just fresh on your mind, but in terms of vaccination rate, COVID cases, deaths, hospitalizations, how would you say Knox County's doing?
So, I think we're in a much better place than we were even just a month ago or 2 months ago, with case counts, hospitalizations, and deaths, certainly. All of those things are trending in the right direction, and we're very happy about that. And the other thing that's trending in the right direction is vaccination percentage. Our vaccination rate has slowed down. We're a little disappointed in that. We want more people to get vaccinated. But our percent of people vaccinating has continued to climb it's even more slowly than it was. So anybody over the age of 16 who can hear my voice can access a COVID vaccine through multiple channels: the health department, pharmacies, private doctors' offices. All of them continue to offer vaccine. And we're hopeful that this week or next, probably next week, since it's Thursday, the CDC or the ACIP will approve COVID vaccine for 12 and up. The Pfizer vaccine is hopefully get approved for that. So the FDA and the Advisory Committee on Immunization Practices are looking at that right now. So even more people will be eligible, and we want those folks to get vaccinated as well. If you take a flu shot, you ought to take a COVID vaccine.
Are you fearful that there is a group of people that can never be reached, or is there a way to reach those people that maybe we haven't tried as a society yet?
Well, I think there are probably 3 groups of people. There's a group of people who, it doesn't matter who tells them or what's said, they're just not going to get the COVID vaccine, and that's their personal choice, and we respect that. I think there's another group of people who are just like, I'm waiting to see, I don't know, more people get vaccinated, and maybe I'm more comfortable with the safety. Maybe I'm concerned about my own personal health, or just have some questions. Those people, we want them to talk to their personal doctor, talk to their friends who've been vaccinated, understand and get their questions answered. They can call us and we can help answer their questions as well. That one-on-one conversation with your personal doctor who knows your medications, knows your medical history, can really help people feel more comfortable with getting the vaccine. And then they make the decision to get the vaccine. And I think there's another group of folks who's just it's inconvenient. You know, I don't have time to go to the doctor. I can't go out to the Broadway location. You know, when I'm in Walgreens, I'm in a big hurry, or maybe they're out of vaccine that day I'm in there, and I don't have time to get it. I don't want to wait for 15 minutes. I mean, just lots of inconveniences. So our team is looking at, as well as our partners are looking at, you know, how can we take down any barriers to that group of people? They'd say, you know, I'd like to get vaccinated, but it's just fitting it into my daily schedule, fitting it into my busy daily life is hard to do. And how do we make that easier for them? We don't have that answer yet, but we're looking into different ways to do that. And so,
When you talk about the 2 out of the 3 groups possibly getting the shot, are you hopeful that, I guess at least for Knox County, even though there's no wall around Knox County, we're part of a state and part of a nation, but do you think herd immunity is still a possibility?
I do. I think herd immunity is a possibility. So, you know, what we have now, we do have some protection because we have people who had COVID and they have some natural immunity. With COVID, we don't know exactly how long that natural immunity lasts. Then we have lots of folks who've at least gotten 1 dose and lots of folks who've gotten 2 doses. So you combine all of that immunity. So we're starting to build some herd immunity within the community. You know, so we do have some people that you know, person A gets COVID, they expose person B, and person B is either partially vaccinated or maybe they have disease. They don't get sick, so they don't pass it on to somebody else. So that's starting to happen. I think that's contributing to our cases going down, but we need more people doing that because the 10 other people that person A exposed might get COVID. So we need more people doing that.
A viewer asked us about having COVID and when or if they should get a vaccine. And I know the CDC recommendation right now is 90 days, but they're hearing something different from someone else, and maybe they're hearing that we don't know how long immunity lasts. Like, where do people who have these questions, who feel like there are 15 different answers, is there one resource you would send them to?
I think if they have a primary care doctor, that's the person they need to talk to. That's the person who knows them, that they have a relationship with. And I think that's the trusted medical expert that they have, that they know, and that's the person I would go to. If they don't have that, you know, the CDC is certainly a really great resource for all of that information. I think sometimes it's kind of hard to find that information sometimes when you get on there and have to navigate the website. But a trusted medical professional, or even if you have a friend who's a medical professional that you trust and you want to talk to, I think I think we're to the point where those one-on-one conversations are going to be important for those folks. And, you know, there's no absolute time after you've had COVID when you should or should not get vaccinated. That 90-day recommendation was really when we didn't have enough vaccine. And that was to say, you know, wait, you have some immunity at least for 90 days, maybe longer. So at least for 90 days you have some immunity. So wait to get your vaccine so those who don't have immunity can get vaccinated. Now that we have plenty of vaccine, you know, they can go ahead and get vaccinated whenever they choose to. They might have a little more robust reaction to the vaccine closer to when they were sick, but they might not. Some people don't. So.
In terms of when all of the 5 core actions will no longer be recommended, is that herd immunity? Is that what we're waiting on? Waiting on a population?
We are waiting on herd immunity, but I would argue also that the 5 core actions, at least 4 of them, staying home when you're sick, washing your hands, cleaning things regularly, and social distancing and masking. But some of those need to stay around, and we've been preaching washing your hands and staying home if you're sick for years and years and years. And if we look at our flu numbers, we really see that those activities help reduce infection in our community. And so some of the things need to stick around, and I think that, you know, in the future, there'll be people who choose to wear a mask during flu season, and I just think that's true. I think there'll be those folks who go, yeah, you know, it's respiratory season. I'm going to wear a mask when I go out in public.
And I know fully vaccinated people can gather outside with no masks. They can gather indoors with fully vaccinated folks with no masks. But there's still this question of why am I wearing a mask at all if I'm fully vaccinated? So let us ask you that again, if you don't mind.
No, that's a great question. So a couple different reasons why you're wearing a mask if you're fully vaccinated. One is you don't know the vaccination status of all the other people around you. And there is some concern, and we need more data to see if this is not going to happen, that even fully vaccinated folks, they get exposed to COVID, they get a very mild case of COVID, and then they can pass it to that unvaccinated person who doesn't have any protection, and they could get really sick. Or maybe they get a little bit sick, but they care for their elderly parent, and they're going to take it home and make their elderly parent really sick. So it's that protecting all of us until we have more data to truly demonstrate that if you're fully vaccinated with COVID, just like the flu, you're not going to get it. You're just unlikely to pass it to somebody else. But we just have to wait on the evidence to prove that.